Myasthenia gravis is a lifelong autoimmune neuromuscular disease that causes certain muscles to weaken easily after use. This muscle fatigue can vary throughout the day and improve with rest. The signals between your nerves and voluntary muscles are disrupted, especially those that control your eyes or eyelids, face, jaw, mouth, neck, throat, arms, hands, legs, and even breathing. While anyone can get myasthenia gravis, it is most commonly diagnosed in women younger than 40 and men older than 60. Children can also be affected, and rarely, babies born to a mother with MG may experience a short-lived version of the disease called neonatal myasthenia, which usually clears up within the first 2 to 3 months of life. Myasthenia gravis is a condition where your immune system attacks the area where nerve cells and muscle fibers meet. This disrupts the chemical messenger, acetylcholine, which tells your muscles to contract. As a result, the more you move your muscles, the weaker you become. In addition to attacking acetylcholine receptors, some people with myasthenia gravis may also have antibodies to other proteins, further disrupting communication between nerves and muscles. Researchers are still trying to figure out why people develop these antibodies, but genes and an enlarged thymus are thought to play a role. While most people with myasthenia gravis have no family history of the disease, about 5% may have a family member with MG or another autoimmune condition. Myasthenia gravis can cause a variety of symptoms that can affect different parts of your body. Some people may experience sudden weakness in their jaw, throat, or breathing muscles, known as myasthenia crisis. If this happens to you, it's important to call 911 immediately. In general, myasthenia gravis may cause symptoms in the following areas: eye muscles, droopy eyelids, ptosis, double vision, diplopia, face, mouth, and throat, slurred speech, a weak or hoarse-sounding voice, trouble chewing or swallowing, a change in your facial expressions, neck, arms, and legs, holding your head up, using your arms or hands, walking, breathing muscles, shortness of breath. It's important to tell your doctor right away if you experience any of these symptoms, especially if you have trouble breathing, as myasthenia gravis can cause respiratory failure when the muscles that help you breathe become too weak. After recognizing the signs of myasthenia gravis, your regular doctor or eye doctor may refer you to a neurologist, a specialized doctor who diagnoses and treats diseases of the brain and nervous system. The neurologist will conduct a neurological exam, checking your muscle strength, coordination, eye movements, and sense of touch. They may also perform follow-up tests to confirm the diagnosis. Blood tests to check for antibodies attacking your muscles and signs of other health issues that may mimic myasthenia gravis. Edrophonium test, which involves a shot of medicine to temporarily block the breakdown of acetylcholine in your weak muscles. Electrical nerve stimulation, such as electromyography, to detect nerve problems and muscle weakness with repeated use. Ice pack or rest test to observe the effects on droopy eyelids and vision. Imaging, like a CT scan or MRI, to examine the thymus gland for a tumor. Pulmonary function test to assess lung function if breathing is affected by muscle weakness. Before you visit your doctor, it's a good idea to prepare a list of questions about myasthenia gravis. Here are some questions you may want to ask. How is myasthenia gravis treated? What can make myasthenia gravis symptoms better or worse? Are there any medications I should avoid? What lifestyle changes should I make? Can I continue working with myasthenia gravis? What type of exercise is best for someone with myasthenia gravis? Is it safe for me to get pregnant with myasthenia gravis? What resources can help me learn more about myasthenia gravis? How can I manage myasthenia gravis along with my other health conditions? Are there any assistance programs to help me pay for myasthenia gravis treatment? Can I participate in a clinical trial? Your doctor may also ask you these questions. Do your symptoms feel worse in the morning or afternoon? How much does muscle weakness affect your daily life? Do any activities or factors help or worsen your symptoms? Which symptoms bother you the most? What are your goals for myasthenia gravis treatment? When it comes to treating myasthenia gravis, your doctor will consider the severity of your symptoms and the progression of your disease. Treatment options may include Drugs to increase muscle strength. These medications, such as pyridostigmine, help boost acetylcholine in your muscles, improving strength within 15 to 30 minutes for some people. Drugs to suppress the immune system. For most people with myasthenia gravis, medication that slows down the immune system is needed. This may include steroids like prednisone or long-term immunosuppressive drugs like azathioprine, mycophenolate mofetil, tacrolimus, or cyclosporin. Thymectomy. Surgical removal of the thymus gland may help ease symptoms, even if there is no tumor present. However, it may take several years to see the full effects of this surgery. Intravenous. 4. Therapy. If symptoms worsen quickly, you may need special treatment through a vein in your neck, chest, or arm. This can include plasmapheresis, intravenous immunoglobulin, IVIG, or monoclonal antibodies to target your overactive immune system. Living with myasthenia gravis can be challenging, but making some healthy lifestyle changes can help improve your quality of life. Here are a few tips to help you manage your condition. Focus on getting good nutrition. If weakness makes it difficult to eat a healthy diet, consider eating small meals throughout the day or eating when you have the most energy. Your doctor can also discuss MG medication options to help boost your strength before meals. Find a suitable exercise routine. While your muscles may tire easily, regular movement can boost your energy in the long run. It's important to work within your limits, so consult with your doctor or a physical therapist to develop a safe workout routine for you. Rest when you're tired. It's still possible to lead an active lifestyle, but it's essential not to push past the early signs of fatigue. Ask your doctor for guidance on recognizing when you need to take breaks. Identify your triggers. Certain factors such as illness, high activity levels, menstruation, childbirth, and specific medications and supplements can worsen MG symptoms. Collaborate with your doctor to understand what to look out for and how to manage these triggers. People with myasthenia gravis often experience mental health conditions like anxiety and depression. If your weakness leads to life-threatening breathing episodes, you may be at higher risk for post-traumatic stress disorder, PTSD. It's important to talk to your doctor about getting connected with a psychologist or therapist who specializes in working with people who have MG or similar conditions. They can provide valuable support and help you learn how to manage life with a chronic illness. Myasthenia gravis symptoms usually peak within the first few years but may become easier to manage over time. It is important to remember that myasthenia gravis is a mostly treatable disease. Working with your doctor to find the best lifestyle changes and medications for you is crucial. While there is no cure for myasthenia gravis, most people with MG can live a full life. There may even be long periods with little to no symptoms. However, it is impossible to predict when or how long these remission periods will last. If you or a loved one has been diagnosed with myasthenia gravis, you may feel like you're the only one dealing with this condition. However, there are many resources and support groups available to you. You can ask your doctor or a social worker about joining an online or in-person support group in your area. You can also connect with the larger myasthenia gravis community through organizations such as the Myasthenia Gravis Foundation of America, Myasthenia Gravis Rare Disease Network, Myasthenia Gravis Hope Foundation, and Conquer Myasthenia Gravis. Additionally, you can find more information and resources about myasthenia gravis and similar conditions by visiting the Autoimmune Association and Muscular Dystrophy Association. These resources can provide you with valuable support, information, and connections to others who understand what you're going through. Supporting a loved one with myasthenia gravis can be challenging, but there are ways you can make a difference. Educate yourself. Myasthenia gravis can be difficult to understand if you don't have it yourself. Organizations like the Myasthenia Gravis Foundation of America offer resources to help you learn more about the disease and how it affects your loved one. Offer specific help. Everyone with myasthenia gravis has different needs, so it's important to ask how you can best support your loved one. Connect with others. There are support groups for caregivers of people with myasthenia gravis, both online and in person. Look for resources through your doctor, social media, or the Myasthenia Gravis Foundation. Take care of yourself. It's okay to ask for help when you need it. Don't be afraid to reach out to friends, family, or mental health professionals for support when caring for someone with myasthenia gravis becomes overwhelming.